This is Daily Homeless News, where tell the stories no one else will. In Arizona, the sight of the unhoused no longer shocks, it blends into the backdrop like palm trees and traffic lights. These images don't make headlines anymore. They've become part of the scenery, part of the routine. Homelessness in Arizona is no longer a crisis hidden in the margins. It's in plain sight. And perhaps the most dangerous part is that we've learned to look past it. So what does it say about a society when human suffering becomes so familiar, so ordinary, that we stop seeing it? By early 2025, Arizona is grappling with a growing crisis. An estimated 13,500 people across the state are experiencing homelessness. That's a 23% increase from just 2 years prior, a surge that has pushed Arizona into the ranks of the fastest growing states for homelessness in America. More than 60% of those individuals are unsheltered, sleeping in parks, alleys, sidewalks, or vehicles, often exposed to the state's unforgiving elements. In Phoenix alone, over 7,500 people are living without shelter, facing daytime temperatures that soar well above 110 degrees during the summer months. For many, that heat isn't just uncomfortable, it's deadly. While California still holds the highest total number of unhoused residents, Arizona's rate of increase has now surpassed several larger states, including Texas and New York. This shift marks a troubling new chapter in the broader story of homeless in America. No longer confined to dense urban centers on the coasts, homelessness has spread rapidly through the Southwest, driven by skyrocketing housing costs, stagnant wages, and insufficient safety nets. Nowhere is this more evident than in Maricopa County, where explosive population growth collides daily with a lack of affordable housing. Rental prices have soared while wages remain relatively flat, leaving thousands with no viable options for secure shelter. Shelters and support services are overwhelmed. Waiting lists stretch for months. Entire families are being forced to live out of their cars or crowd into motel rooms they can barely afford, often one crisis away from the street. The numbers themselves are alarming, but the trend line is even more so. Advocates warn that without swift, coordinated action, the number of unhoused people in Arizona could surpass 16,000 by 2026. That's not just a statistic, it's a reflection of lives unraveling in plain sight. There's a dangerous myth we need to break that homelessness only happens to a certain type of person. Someone who made bad choices. Someone far from who we are. But the truth about being homeless in America is far more uncomfortable. It can happen to almost anyone. And in Arizona, it's happening faster than nearly anywhere else. From 2018 to 2025, the number of homeless individuals in Arizona has nearly doubled, with older adults and single women being the two fastest growing groups. Many of these people once had homes, jobs, even savings. But now they sleep in cars, public restrooms, or makeshift tents hidden behind strip malls. Some are mothers escaping abusive partners, with toddlers wrapped in thrift store blankets. Others are seniors who lost their apartments after rent hikes wiped out their fixed incomes. In fact, adults over 60 now make up more than 20% of the state's homeless population, an alarming rise that speaks to a broader failure of our safety net. And then there are the people who are still working. a growing number of Arizona's homeless are fully employed rideshare drivers, waitresses, custodians, but they simply can't afford rent. The National Low-Income Housing Coalition reports that in Arizona, you need to earn at least $25.40 an hour to afford a modest two-bedroom rental. Yet the average renter's wage hovers around $20. That gap leaves thousands living paycheck to paycheck with zero room for emergencies. Even more heartbreaking is the rise of homeless youth. LGBT teens in particular face higher risks of being kicked out of their homes. Without ID, without credit, without family support, they're left to fend for themselves in dangerous urban corridors. Native American communities are also severely impacted. Though they represent a small percentage of Arizona's population, indigenous people are overrepresented in shelters and street encampments. This reflects generations of systemic inequality and lack of access to services. And let's not forget domestic violence survivors. Over 40% of homeless women report fleeing abuse as a primary reason for losing their home. Many face the impossible choice between staying in a violent relationship or facing the streets with their children. These are not fringe populations. These are our neighbors, our coworkers, our grandparents. And the most chilling part? Experts warn that if no serious policy changes are made, Arizona's homeless population could surpass 16,000 by 2026. So can the social safety net withstand the weight of this growing crisis? That's the question now looming over policymakers, service providers, and communities alike. Arizona's housing assistance programs are already stretched thin. Emergency shelters often operate at full capacity, while wait lists for subsidized housing stretch for months, sometimes years. Nonprofit providers do what they can, but without sustainable funding and statewide coordination, their reach is limited. And when temperatures soar above 110 degrees in cities like Phoenix, that's not just an inconvenience, it's a life-threatening gap. Medicaid expansion has helped more people access mental health and addiction services, but many unhoused individuals still fall through the cracks. The lack of integrated case management means someone with schizophrenia might get emergency care one day, then be discharged back to the street the next without medication, a support plan, or even identification. The challenge is that Arizona's population is growing fast, while affordable housing is not keeping pace. According to the National Low-Income Housing Coalition, the state has a deficit of over 270,000 affordable and available rental homes for extremely low-income renters. So even when people qualify for help, there's often nothing available. It's easy to point fingers at government, at bureaucracy, at rising costs, but the truth is more complex. The system wasn't built to handle this scale of need. And unless structural reforms are made, investments in permanent housing, stronger tenant protections, expanded health services, the social safety net will continue to fray. Homeless in America isn't just about individual misfortune. It's a reflection of broken systems. And those systems left unrepaired could soon collapse under the weight of their own neglect. At the heart of Arizona's growing homelessness crisis lies a complex mix of economic strain, housing shortage, and slow-moving political response. From 2019 to 2024, rent prices in cities like Phoenix rose by more than 72%, while median incomes failed to grow at a comparable rate. This widening gap has left more than half of the state's renters officially cost-burdened, spending over 30% of their income just to keep a roof over their heads. For many, all it takes is a medical bill, a car repair, or a week without work to fall behind. In a system so fragile, homelessness becomes not an exception but an inevitability. The structural imbalance is made worse by Arizona's severe lack of affordable housing. Current estimates suggest the state is short by at least 270,000 low-income units. Local zoning laws, many of which were written decades ago, continue to restrict the development of multifamily and income-restricted housing, especially in fast-growing suburban areas. While these regulations were often intended to preserve neighborhood character or manage infrastructure loads, they now act as barriers to the kind of diverse housing solutions that could ease the crisis. At the national level, federal policy shifts have had ripple effects. During the Trump administration, budget reductions totaling $26 billion were made to the Department of Housing and Urban Development, HUD, significantly cutting resources for housing vouchers and community development. While proponents argued that such cuts were part of broader fiscal responsibility goals, critics warned that the reductions came at the expense of already vulnerable populations. In particular, a policy trend toward conditional aid requiring individuals to meet sobriety or behavioral standards before accessing shelter sparked debate. Supporters saw it as encouraging accountability, while detractors saw it as criminalizing poverty. This broader conversation isn't unique to Arizona. It mirrors what's happening in many parts of the country and highlights why the term homeless in America resonates so widely today. When housing is increasingly treated as a financial asset rather than a basic need, questions arise: who is being left out of the equation? And what kind of long-term outcomes does this system create for our cities, our communities, and our sense of shared responsibility? Arizona's homelessness crisis goes beyond mere economics. It speaks to a deeper issue: the lack of cohesive political will. Across the state, responses have been inconsistent, at times well-intentioned, but often disjointed or even contradictory. On one side, initiatives like the Arizona Housing Fund and several localized pilot programs strive to provide targeted support for those experiencing homelessness. These efforts show promise, but they operate in silos. Meanwhile, cities such as Scottsdale and Mesa have enacted ordinances that prohibit sleeping in public spaces, effectively criminalizing the very existence of unhoused individuals. These policies, while framed as public safety measures, tend to displace people rather than address root causes. They push the most vulnerable into remote, hazardous areas with even fewer resources, deepening both invisibility and risk. At the state level, the legislature remains at odds. Some lawmakers advocate expanding housing-first strategies, investing in supportive housing, and strengthening tenant protections. They argue that these approaches, backed by national research, offer long-term cost savings and humane solutions. Others, however, resist such programs, citing concerns about government overreach, dependency, or fiscal sustainability. This philosophical divide creates inertia, stalling critical funding and creating confusion among local agencies trying to implement meaningful reform. The end result is a fragmented and uneven system where a person's access to support often depends less on their actual need and more on their zip code. In a state facing one of the fastest growing rates of homelessness in America, that inconsistency is more than a bureaucratic flaw. It's a moral dilemma. If political leaders can't reach consensus on whether housing should be considered a basic human right, how can Arizona ever expect to move forward in solving a crisis that demands both empathy and coordination? This isn't about choosing sides, it's about deciding whether we view homelessness as a shared societal failure or as an individual misfortune to be dealt with quietly, out of public view. To be fair, not everything has been a failure. In Maricopa County, several initiatives show real potential. Project Haven, for example, focuses on providing housing for elderly individuals experiencing homelessness, a group that's increasingly vulnerable in Arizona's brutal climate. There's also the homeless outreach teams, HOT, whose mission is to engage directly with unhoused individuals and help connect them to services like shelter, healthcare, site, and case management. These are smart, compassionate programs with measurable impact. But the issue is scale. Despite the promise these programs show, they operate on a shoestring. Their reach is limited, their capacity strained. Many nonprofits on the front lines, those providing nightly shelter, daily meals, crime tea, and access to medical or addiction services, report waiting months just to receive grant money they were already approved for. Some organizations have had to pause operations or reduce services not because of lack of demand, but because of delays in funding and lack of staff. Meanwhile, the number of people in need continues to rise. And with more tents springing up along highways and public parks filling with makeshift encampments, the urgency is growing louder. Layered over all this is a tangled web of bureaucracy, where overlapping jurisdictions, endless paperwork, and political posturing often stand in the way of rapid response. Even well-meaning policies can get stuck in endless cycles of committee debates and delayed implementation. It leads to a difficult but necessary question. Are we truly solving homelessness in America, or simply managing it in a way that keeps it just out of sight, just under control, without ever addressing the root causes? This isn't just a question for policymakers, it's one that communities, voters, and taxpayers will eventually have to answer. If Arizona wants to change course, it needs more than incremental adjustments. It needs a bold, compassionate, and pragmatic overhaul. That transformation starts with scaling up the housing first model across the state. This approach doesn't wait for someone to get clean, find a job, or navigate complex systems before offering housing. Instead, it recognizes that stability is the foundation for progress. In cities like Houston, Housing First has helped reduce homelessness by over 60% in the last decade. It's not a theory, it's a working solution. But shelter alone won't solve a crisis this complex. Arizona must also revisit its outdated zoning regulations, which currently limit the construction of affordable alternatives like modular housing, tiny homes, and accessory dwelling units, ADUs. Reforming these codes can unlock land use and give communities more flexibility to meet their own housing needs. At the same time, Encouraging public-private partnerships through targeted tax credits can bring developers to the table, especially those willing to build units priced for low-income residents. Still, housing is only part of the equation. Long-term solutions mean embedding healthcare, mental health support, and job training directly into housing programs. When people move into a home with wraparound services, they're not just surviving, they're healing, recovering, and rebuilding. None of this is easy, and it raises an uncomfortable question. Are we prepared to shift our mindset and treat housing as a human right, a public good, rather than a commodity to be won or lost in the market? That's the real challenge. Because solving the crisis of the homeless in America will take more than construction. It will take political will, public trust, and a shared belief that everyone deserves a place to live no matter their past, income, or circumstance. If trends continue unchecked, Arizona could see over 20,000 people unhoused by 2028. Rising temperatures, increasing evictions, and stagnant wages form a perfect storm that could make the crisis irreversible. But the future is not set in stone. With decisive policy changes, funding commitments, and grassroots advocacy, Arizona could transform into a model of human-centered urban planning. The potential is there. So is the need. The real question is not whether we can fix the crisis, but whether we will choose to. Homeless in America is not just a coastal phenomenon. Then it is here, it is now, and it is growing. Arizona stands at a critical juncture. Continue down a path of reactive policy and moral indifference, or rise to meet the challenge with vision and empathy. A civilized society is judged not by its wealth, but by how it treats its most vulnerable. Housing is not a luxury. It is a foundation. Without it, everything else, health, education, safety, opportunity, crumbles. So we end with this: how many more lives must unravel on our sidewalks before we dare to build something better? 4 times in this piece we've referred to the phrase homeless in America. It's not just a description. It's a call to attention. And for Arizona, that attention is long overdue.